It's with great pleasure and full dedication and commitment that I add my voice in support of the creation of the Sanitation and Hygiene Fund. This initiative comes at the right time as we are facing a global pandemic that is nothing but a stark reminder on the fundamental importance of sanitation and hygiene and its crucial link to global health. For decades, the world has been facing an escalating sanitation and hygiene crisis. In my own country, Uganda, an estimated 75% of the overall disease burden is linked to the lack of sanitation and hygiene. Each year, 23,000 Ugandans die from diarrhea, and 90% of these deaths are directly attributable to inadequate water, poor sanitation, and unhygienic practices. In other words, 20,000 preventable deaths annually, not only depleting financial resources, but causing human suffering, grief, and despair, and undermining the well-being and prosperity of societies and individuals. All in all, poor sanitation and hygiene costs my country some $177 million annually, and the human cost is immense. Premature deaths of children under 5, and a catastrophic impact on Ugandans' girls and women. They carry the burden of poor sanitation, are unable to manage menstruation with dignity, and suffer stigma, economic loss, and unequal access to social participation and decision making. This is not acceptable. We know that investing in sanitation and hygiene is one of the most effective ways to safeguard and accelerate progress in health, education, climate change, human rights, women's rights, and human dignity. However, due to limited investments in sanitation and hygiene in the past, there remains an enormous job ahead of us, and the only way forward is for countries like my own to significantly scale up our national efforts and investments. I am convinced that the Sanitation and Hygiene Fund, through investments complementing our own, will play a transformational role in accelerating implementation of our national strategies and plans. I hereby state my full support and that of the government of Uganda for the Sanitation and Hygiene Fund. And I reiterate our commitment to ensure that it becomes a turning point with catalytic impact on our national endeavor to end the sanitation and hygiene crisis we have lived with for a long time. I would like to conclude by calling upon governments like my own, donor countries, and development partners around the world to join hands, act now, and take investments in sanitation and hygiene to an unprecedented scale. A strategic investment in sanitation, hygiene, and menstrual health will directly improve the lives of millions of the world's poorest, especially women and girls, and empower them to learn, work, and live without stigma. And it will significantly accelerate achievements of all the sustainable development goals for God and my country.